Currently, there are only 2 Fortune 500 companies run by African American women. One of those women is Roz Brewer, who is leading Walgreens Boots Alliance, a well-known pharmacy chain. I sat down with Roz Brewer to talk about how she's trying to transform that company into one that also offers additional healthcare services to its customers. I have noticed that Walgreens and another company that's also in the drugstore area, I won't mention their name, but a competitor of yours, both of you seem to be interested in being in the healthcare business as opposed to the pharmaceutical drugstore business. Why is that? What's so much better about the healthcare business?
So first of all, Walgreens started in 1901, and when you think about drug dispensing, it's critical to all of us at some point in our lives. But one of the things that's very clear to us, ending the pandemic or in the middle of the pandemic, we realized our relationship with our customers and our patients was so much more critical. We delivered 70 million shots in arms during the time of the pandemic, but the relationship just went to the next level. Pharmacists have always been consultants with customers and patients, and you will see your pharmacist 10 times more than you see your primary care physician. But the idea of having a primary care physician interacting with the pharmacist is the way of the future. And we will need that ecosystem around us.
Okay, so in your case, Walgreens' case, you have begun a business, you've bought a lot of companies in this area that are primary physician companies. In other words,
that's right.
You buy the practices of primary physicians, and then in effect those doctors are working for Walgreens, and they are still serving their patients, but they're in effect employees of Walgreens. Is that right?
That's correct. So we just purchased Summit Health in the New Jersey, New York area. And now we're one of the largest primary care physician practices in the country.
So primary care physician practice, how many people in the United States of the 330 million people we have or so, how many of them actually have a primary physician?
From what we understand, less than 30% of Americans have a primary care physician.
Okay. And you think it's good to get an annual physical every year? I know you're not a doctor, but...
No, I'm not a doctor. But, I will tell you that, we're all going to be responsible for our health, both financially and managing our own care. And to get a physical every year is a good database for you, a baseline to build for yourself, because it's going to fall back on you. You need to know more about your personal health so that you can interact effectively with your primary care physician.
So I get an annual physical every year. I try to starve myself for the 2 weeks before the annual
Yes,
physical.
I have mine tomorrow, yes.
I have found it doesn't work, but okay. What do you think the biggest healthcare challenge is for Americans? Is it that we're overweight, we take too many drugs? What is the problem?
So I think it's two-pronged. One is that, yes, obesity is a big problem, but I think it's negligence, but it's not intentional. I think people are confused about the cost and access of healthcare, and they think it's going to cost them a lot. And when people have variable employment, as we've seen across these last several years, is that, they're not quite sure what their insurance will cover and not cover, and what their out-of-pocket expense will be. So they avoid going to the doctor. And I think that is something we've got to bring clarity to, which is why, the digital side of healthcare is going to become very important, so that we can all look at our mobile devices and understand what's going on with their bodies.
COVID brought a lot of people into the drugstores to get their COVID shots, I guess. Has business picked up or gone down since COVID has more or less waned a bit in terms of the people getting shots?
What we're seeing at Walgreens is that we created, an expanded relationship. It did start with immunizations, but now people are very deliberate about their flu shots, and so they're still getting COVID shots today, vaccines today, and they're getting flu shots in combination. Our retail business, if you look at our prior earnings, is up and performing well, especially as we transition into healthcare. The front of our stores are picking up.
So I read that post-COVID, it's difficult for companies like yours to get entry-level people to come in. They either don't want to come back into the workforce, or they don't want the job that you can provide them. Is it hard for you to get people? I notice in the stores that I go to, the drugstores, they're always fresh people all the time, new people.
Yes, there's a lot of turnover at the hourly level, I will admit. But as we have these conversations, it's becoming less about pay and more about their lifestyle and what they want to do and progression. And so what we're encouraging is that, work at a Walgreens store and you can become a shift manager and escalate. And that's really what they want to think about as a career and development.
So if you were an entry-level person at one of these stores like Walgreens, what kind of compensation do you get? More above the minimum wage, but you pay like $15 an hour or something like that?
Exactly. And then it moves up based on, shift manager and other responsibilities in the building.
So I've noticed that in a lot of the stores I go into, there used to be younger people, post-college or something, who were the younger people working, servicing the drugstore. Now I see a lot of people who are older, like post-retirement kind of people doing it. Is that a phenomenon you've observed?
We see both. On the younger end of the spectrum, it's those looking for development or fill-in job while they're in college and doing something otherwise in their lives. And then the retirement community is a very, rich environment for us to recruit from.
So I notice in a couple of drugstores, even in my area, which is not the poorest area in Washington, D.C., it's a nice upscale sort of area. When I want to get razor blades, you have to go to the front of the place and ask somebody to unlock it. Why are you locking up razor blades and other things that I might want to buy?
Yes. So, this is a national problem. And, this isn't, random theft. This is organized crime. And, state legislation has put guidelines on, how much the theft that you can steal before you're convicted. So it's $1,000 limit. But we have been partnering with other retailers and sharing our camera feed. I know some of our partners here from Walmart are here, but we're all part of an organization that's coming together that says if we can put our camera feed together and tell that person has been in our store and their store, and the numbers are higher than 1,000. So we've been able to impact these theft rings most recently.
What are the things that are unlocking key the most? What are people trying to steal the most, other than razor blades, I guess?
I will tell you, it started at razor blades because that's such a high ticket item, but it's a lot of cosmetics. But really what happens is that they take advantage of what I would call the elbow move, and they just come in and swipe a counter. And so it's just a matter of categories now almost, and not just particular.
So what is the most profitable high margin thing that you all sell?
I'd have to say it's in our cosmetics area is one, and then in some of our durable medical goods, some of our take-home testing and things like that are very nice margin item.
What is the most frequent thing that you sell?
Most frequent thing is probably toiletries like toothpaste and personal care items of those types.
And why is it that whenever there is like a scare coming along or a pandemic or something, people rush to buy toilet paper? You notice that people are they're stockpiling toilet paper.
It's called hoarding, and it's one of those things you never want to be without.
Okay. What's the biggest surprise of being the CEO of Walgreens?
It's how complex healthcare is, and how unfortunate it is to try and manage, personal health in the health systems that we've set up in this country.
You're from Detroit. Your family, how many siblings do you have?
I have 3 sisters and a brother. Mm-hmm.
Okay, and you're the youngest?
I'm the youngest of 5.
Okay, and are any of the others running drugstore chains?
No, but I do have a sister that's a pharmacist.
Wow, is she at Walgreens or?
No, she's not. No, we don't want to mix.
Okay. So, all right. So, what did your parents do?
So both my parents are deceased, but my parents worked in the auto industry, and so my dad eventually worked as a member of management, and my mom worked in hourly labor at
so
General Motors.
You can go to many good colleges. You went to Spelman, an excellent college in Atlanta. Why did you choose Spelman?
Well, I chose Spelman because, I grew up in Michigan. I wanted to do something a little different, get out of the cold weather, but it was also a chance for me to be at an institution that I thought really reflected me, who I was, and what I wanted to do. And I think also, too, I got a scholarship, and so that was helpful. At the time, there were 4 of us in college. And so I was actually pursuing, support at that time, too.
And what did you major in? What did you want to be?
I majored in chemistry, and I thought, I had always been pretty decent in the math and sciences, so I just did what I knew what to do. And I thought I'd either go into medicine or engineering. And actually, I was recruited away by Kimberly-Clark to work in long-range research as a chemist. So I I moved in that
You
direction.
thought you might go to medical school, but Kimberly-Clark stole you away. Right. Okay.
Right.
So what did you do for 22 years at Kimberly-Clark?
So I started off in long-range research as a chemist. I was an organic chemist, and I had interned my summers at General Motors. And so I worked in chemistry there. I worked in analytical chemistry, moved into organic, worked in polymer science, and then I worked in on one of the businesses. I got a chance to join the M&A team probably about 6 years into my career. And at the time, it was when Kimberly-Clark was converting itself from a paper company to consumer products company. And we acquired several companies, and I got to run one of those companies, and I just stayed on the business side after that.
Okay, so you're doing that, you're there 22 years, you're happy presumably, and all of a sudden somebody calls you up and says, how about working for Walmart? What did you say?
No.
No.
On the first call, I said no. Probably the first, second, and third call, I said no. If initially they were speaking to me about a job in human resources, and I really don't have that skill set. And so once an opportunity came about that had a P&L to it, I joined the company, and I was group president at Kimberly-Clark, and I took a VP regional job to run the state of Georgia.
Okay, so you're at Walmart, and then somebody calls up and says, how would you like to run Sam's Club? Is that right?
Yes, well, a lot happened in the first 5 years where I ran Georgia, the Southeast, then the East Coast of Walmart stores, and then I was a candidate for the Sam's Club job.
All right, so you're minding your business, you're running Sam's Club eventually, right?
Right.
You did it for 5 years?
Yes, I did.
Okay, so you're there for 5 years, you're the CEO, it's a pretty good job, I guess. Where you work, where were you living to do that?
I was in Bentonville, Arkansas.
Okay, you're in Bentonville, and all of a sudden, I guess another headhunter called you up and said, how would you like to go to Starbucks? Is that right?
No, actually, I made the decision to leave Walmart stores, and I was on the board of Starbucks, and I had taken the board seat as I was leaving Sam's Club, and so I had attending a board meeting, and Howard Schultz and Kevin Johnson approached me to become the chief operating officer.
But you said you don't really drink coffee, or you didn't say that?
I was a tea drinker at the time, so that was interesting. And Seattle wasn't in my plans, but I fell in love with the brand and the company. I saw a great opportunity to help the company operate a little stronger.
Okay, so you moved from Bentonville to Seattle, and you
Yes.
became the chief operating officer of Starbucks, and Starbucks has become so successful because its coffee is better than other people's coffee, or what is the reason you think it's so successful?
I think it's two things. I think it is definitely quality coffee. It's customized, right, for all drinking palates. I also think that it's their coffee practices along with the baristas in the store. I think the baristas are top-notch and really interact great with the customer.
What's the most popular thing that people ask for when they go to Starbucks? Is it?
Oh gosh, really just a simple pike, which is a black coffee, is still very popular at Starbucks.
Okay.
The cold beverages are really, trending, so.
Okay, so you're there, you're doing that for 4 years.
Yes.
And all of a sudden, I assume a headhunter calls you again?
Yeah, now that was a head.
All right, a headhunter calls you up and says, how would you like to run Walgreens? And you say, I'm happy at Starbucks, or what?
I say, I think about it for a minute, because I was enjoying Starbucks. I wanted to be there, and didn't really think of myself coming back into that level of retail. But it was the pandemic, and there were so many people dying at that point, and people who were adverse to being vaccinated. And I knew for sure, because I follow the science on things, my background is in chemistry, and the science just screamed, that if a vaccine became available, we could curtail this.
But at Starbucks, you have the perfect name for that, brewer, right? So
Yes.
They ever mention that to you?
I got that all the time. Okay. Everything was what's brewing and all these, yes, hashtag everything.
So
yes.
when you told Howard Schultz you're leaving to go to another company, what did he say?
Actually, I had that conversation with Kevin first. It wasn't pleasant. I think the board was a little surprised, but we made it work.
So do you ever go to Starbucks now?
Every day.
Every day,
yes.
okay.
Yes.
You ever go to Sam's Club every day still?
Yes, not every day. I bulk up and
Loyal.
yes.
Okay. So now, what's the biggest surprise of being the CEO of Walgreens?
You know, I think the biggest surprise to me was how complex healthcare is and how unfortunate it is to try and manage, personal health in the health systems that we've set up in this country. And it's perplexing. I think that this marketplace is ripe for disruption, and I'm sort of drawn to transformation and disruption. So I became super excited about it once I began to peel back the understanding of the business.
Right. So you're the CEO of a healthcare company, in effect. It does.
Yes.
You have the physician's business, and you also have the pharmaceutical business. What do you do to stay healthy? Because you have to be a role model, right? You can't look like you're not healthy, right? So how do you have to exercise a lot, or what?
Yeah, well, first and foremost, like I said, my health exam is tomorrow morning. I'll be heading back to Chicago to get that done. So I take care of myself in that way. I like supplements, so I take my vitamins daily, and then I will tell you that I work out 3 or 4 times a week as best I can, and so I make it a priority for sure.
I think about working out 3 or 4 times a week,
Yes.
but I actually don't do it.
The thing I haven't solved, though, is sleep. And I think that's our biggest opportunity. If I get sleep down, maybe I can lay off of the supplements a little bit.
Well, you're supposed to get 8 hours of sleep a night.
No way.
No, you don't get 8
No
hours.
way.
So let me ask you what it feels like to be in your situation. Is it more disappointing or surprising that of all the CEOs in the Fortune 500, there are only 2 female African-American CEOs? Only 2.
Right.
You and the CEO of Teachers is the only other one, I think.
Yes, TIA.
And so are you surprised that at this late date in our history, we only have 2, or disappointed?
Well, I'm more disappointed than I am surprised. I'm not surprised because I know what it took for me to get here, and I know the trials and tribulations that I've been through. And, I'm not quite sure a lot of people would want to withstand that. But I would tell you that the disappointing part is that this is just is totally ridiculous that there's only 2 of us. I think, it's going to go beyond mentoring and sponsoring. It's pipeline, filling the pipeline effectively, getting people of different races in operating roles, and having the confidence that, that they can do it because they absolutely can.
So in your career, what has been a bigger problem, being a female or being African American, or neither?
I would have to say being African American. I think that it is still, an issue in our environment to accept people of different races, more so than it is gender. I think I've seen a lot of progress with women in corporate America, and I'd like to see more progress with people of color.
So as we talk today, you're in Washington, D.C.
Yes.
I presume you're here to meet with government officials to some extent. Do you find that an uplifting experience when you do that?
I find quite a few teachable moments for both of us. I try and bring the real life experience of healthcare to legislation so that when the right decisions are in front of them, they make great decisions.
So what is the principal thing that let's say the drugstore industry would like to have the Congress do?
First and foremost, I would love to see our pharmacists to operate at the top of their license. And so for them to pass legislation that will allow pharmacists to both test and treat so that there's not a second step in, just imagine a mom who has to take a child out of school and take them to pick up a prescription only to find out that the child is still sick and go back to the doctor. So if it's an ear infection, strep throat, we can do a test in the store to figure out, and then pass on the prescription, and the recovery period is smoother.
You
and
need
everyone goes
legislation
back.
for that?
We absolutely do, yes.
Okay. And do you meet people from the administration as well, or?
I do. You know, most recently, there's members of Senate that are primary care physicians, and so I know who they are, so I meet with them regularly because they understand us best and help us carry the message, you know, throughout.
So your competitor, principal one, is CVS, I think probably their largest competitor, some people would say. If CVS is right here and Walgreens is right there and I could go to either one, why should I go to Walgreens over CVS? I could pick either one. Why are you better than CVS?
So glad you asked me that question. You know, I believe our customer experience model is stronger. I think that when you walk into a Walgreens store, you may not have this happen to you every time, but I think you get a nice greeting from our cashiers, and I think our pharmacists are second to none.
If you walk into a Walgreens today, would they know you?
It depends. If I worked out that morning, no, because they don't recognize me, but sometimes no, sometimes yes. And sometimes I can hear them say that I'm in the store. You know, I can hear them chattering.
So when they say,
Yes.
So you walk into a store though, and if you don't like something, you call the manager and say, this isn't good, or do you just kind of tell them when you get back to the office?
So really what I do is I take a picture of it and I send it back to my team at the office and say, I wonder why this is happening, right? Because usually it's a decision we've made that is causing something to happen. 9 times out of 10, it's something we've done versus what the store has done.
So if you need a prescription, do you have to wait in line? Or
I do. I have to wait in line.
you wait in line?
I do.
You ever say, I'm the CEO of this company, I'm waiting in line?
Absolutely not. No, but usually there's not too much of a line. So, but I know the best hours to show up too.
Obviously, you've had an incredible career. Did your parents live to see your success?
You know, it's interesting. If I could describe my dad would define my success as what I did in my, throughout my education. My dad was that father that showed up to everything. If I was getting the yellow ribbon and not the gold ribbon, he was still there rooting me on. So he really knew who I was as an individual. You know, we talked about that a lot. He passed away 6 weeks before I finished Spelman, and we had conversations. He saw something in me and he let me know that. So I think he is looking down. I think he kind of knew something good was going to happen. My mom definitely lived through a good part of this. And then my siblings are sharing in, the excitement in our family.
But your siblings, you were the youngest, your siblings say, well, when we were beating you up, we didn't really mean it?
Oh yeah, the days my brother would, right. The days my brother would throw me across the room, yes. But we're very close now.
Right. And they have to wait in line for prescriptions. They can. So sometimes headhunters have called you and said, would you be interested in this job or that? If a headhunter called you now for another corporate job,
No, I would not. I really, truly think this is the culmination of everything I've done in my life is coming to bear right now. This is what I want to do. We're being very intentional about impacting medically underserved communities. That's important to me.